Well, hello and welcome to another episode of Coffee Talk with Encore. Today, we're going to be discussing the topic of having difficult conversations with family members. And as all clinicians are aware, there are times when communicating with our patients' family members can definitely be hard to do. But preparing for these kinds of conversations and using an educational approach to communicating can make family conversations go just a little bit easier. Well, today we'd like to provide some insight and approaches that might help your next conversation with family members go just a little bit easier.
Now, I think as a clinician, one of the most difficult conversations that I've had to have is when a patient of ours is no longer progressing or where they've had some sort of medical event happen where we, as the skilled clinician, know that they are not going to achieve their prior level of function. Unfortunately, not everyone gets back to baseline. And I think that that can be really difficult to have those conversations. One thing that I think that we need to think of when we are having these conversations is we need to show a little bit of empathy. So, kind of putting ourselves in their shoes. This is someone's mom. This is someone's son. This is someone's family member, and they don't necessarily have that medical background and that knowledge that we have. So when we're telling them, we don't think that they're going to make any more progress. We need to maybe come up with a different discharge plan, whatever it may be. That can be very shocking and it can be very upsetting. Family members may have an expectation that their loved one is going to get better, they're going to come back home and everything will be back to normal. And so we're kind of putting a little bit of shock in their system when we say that we don't necessarily think that's going to happen. Now, just because we're saying that doesn't mean that we're going to continue to treat if it's no longer beneficial. We're not going to keep them on our caseload. Just because we're showing empathy doesn't mean that we're going to continue that treatment. Everything that we do has to still remain skilled. So we do want to keep that in mind.
Definitely. And Kelly, I think that you made some really great points. And the entire time that you were talking, I was thinking of all the examples in my family when a loved one has been in the hospital or had to go to a rehab facility. And we're actually going through this again right now with my husband's grandma, who is up there in age. She's 97. And I'm kind of coaching the family to kind of ask, the right questions, ask the doctor this, ask the physical therapist this, talk to the OT. So I think that it's really important to kind of have that open conversation starting on day one. So anytime that a family member of mine is in a hospital or any sort of healthcare facility, I try to guide them to ask the right questions in order to get, the answers that, they really want. So I think we can also guide families to be advocates for their loved one. So asking the patient what they want for their care, I think is really, really important. And I think that sometimes our family members that we encounter in our facilities sometimes forget that. So yeah, that maybe they have a loved one in our facility with a hip fracture. Their advanced age, maybe they have a lot of comorbidities and the prognosis for rehab just isn't great at this point based on their medical status. And then when they turn to their loved one and they ask, do you want to do this? And they say no, sometimes they're actually pretty shocked when they actually ask their loved one what they want their care to look like. So I think that this, kind of communicating openly on day one, setting the expectations that this is, what can happen, with your loved one's diagnosis. This could be what happens with their plan of care, but we have all those other nuances like managed care insurances who really look at those dollars and are kind of deciding when our therapy services end based on what we're documenting, of course. Those patients who are having exacerbation of confusion, we have to be really upfront and honest to say maybe with this diagnosis and these underlying impairments, your loved one may not be able to go home alone and unassisted anymore. You're going to have to put a lot of things in place in order for them to be safe and successful in that environment. And as a speech therapist, I often dealt with this, and I still get questions about this, about diet levels. So even when, maybe we are saying that this patient probably shouldn't eat this particular diet consistency because of safety, we really need to have an open conversation with the other people in the department in the interdisciplinary team, the medical doctor, and kind of decide as the family and the patient what they want. So just because we're making a recommendation doesn't mean that they have to always go with our recommendation. They need to be informed about what the options are. So having that open conversation, that empathy for the patients and their families in our facilities is really paramount to start on day one.
So these conversations, I always call them difficult conversations, right? They're the conversations that you get a little bit queasy before you start to have them. You know, going into that conversation, this is going to be very emotional. There's going to be a lot that I'm telling this patient or I'm telling this family member. There's a lot for them to think about. And so making that conversation easier for yourself and for them, I like to think about and prep with my team how we're going to have the conversation. So first of all, it shouldn't be in a gym or a public space, right? It shouldn't be in the patient's room if they have a roommate that's active and cognitively intact and going to be interrupting the conversation. So we need to find a quiet space, hopefully a space that's very informal. You want to have a small table so that you can sit close. You don't want to bring someone down to a boardroom if you don't have to. So if you have a lot of family members, you might need to go with a boardroom, but the more intimate the setting, the less intimidating that conversation is going to be for the patients and the family. Then you want to sit down with your team ahead of time and discuss as a team how that conversation is going to go. So make sure you have someone who's leading the conversation and that you all know what's going to be said before you start. The worst way for this conversation to go is for the team members themselves to start debating and discussing in the middle of the conversation. You want to have that all done before you get in front of that patient and family member. You want to come across with a very clear plan for the patient of best case scenario, worst case scenario. These are our options. And this is how we're going to help you no matter what you choose or what happens. And make sure that you have resources available for the family member so that you're not just dumping information on them and then walking away and to struggle. So anything that you can give them and make sure that you're bringing it in writing if you have it, materials that you can provide them, resources that they can look at, people that they can reach out to for help so that they can take those next steps and that they feel like you've supported them. And then something that seems really silly, but it's going to come up a lot when you have these conversations. Like I said, they're very emotional. So you do want to have some tissues available, but don't put them in the center of the table. You don't want it to be the first thing that they see when they walk in the room, because that kind of sets the tone. So have them available so you don't have to go hunting for them, but try to keep them out of line of sight until they're needed.
You know, I have never thought about that with the tissues before. I'm like, oh my gosh, isn't that the case? So it's really important, I think, to think of those things. I mean, there's so many parts and pieces of those conversations that we have. And you want to think about from the other person's perspective, what this is going to mean to them when you have those conversations, for sure. And we want to make sure that as we're, talking to family members, that we're looking to gain their support. The support that family members have, they significantly impact the carryover of the things that we're doing in therapy, like even the exercises and the strategies and the things that we're educating our patients on. Those family members are there to help our patients that we're working with both obtain and maintain the patient's functional independence. So we really want to make sure that we're getting through these potentially, difficult conversations so that we're getting everyone on the same page. And together, then we can make that positive difference and having our patients really work toward achieving their goals. So I really like all the information that truly we've shared today. I hope it can be of benefit to others that are viewing this and listening to this conversation. So I would like to thank everyone for joining us today and listening in to hear our discussion on having difficult conversations with family members. And we look forward to having you tune in again for our next episode of Coffee Talk with Encore.